Hi, today we're going to talk about the different ways your options, so to speak, for taking testosterone and estrogen. And we're going to limit ourselves to just those two hormones because they're related to each other. Testosterone is one step away from estrogen by the enzyme aromatase. Aromatase lives in the fat cells. So I don't think I knew in medical school how closely linked those two hormones are, but they're just one step apart from each other. So testosterone and estrogen should never be taken by mouth, either pills or troches. Troches, if you've never heard of troches before, it's like a lozenge and it goes next to your cheek. And the theory is that it is absorbed through the lining of your cheek straight into the body's bloodstream. The problem is that there's no way to have a lozenge in your mouth and some of it doesn't get mixed with your spit and gets swallowed into your stomach. Once the hormone goes into your stomach, that blood supply picks up whatever you've eaten and takes it straight to the liver for processing. So the testosterone and estrogen are hitting the liver before they hit the rest of the body. So some of that will be metabolized, and then some of it will go into the bloodstream as testosterone and estrogen. It's too hard on the liver. It increases your total body inflammation. It increases your risk for blood clots, and it increases your cancer risk. So that's not a route that I use to help people with their testosterone and estrogen levels. The human body makes three types of estrogen: estrone, estradiol, estriol. Estrone is more cancer promoting, so we never replace that one anymore. It used to be probably 20, 30 years ago, they did replace estrone in a format called Tri-Est. The thought being if the human body made it, then we probably needed it for some reason. With more medical research, now we know that it just promotes cancer and there's really no reason to replace that one. So we don't actively replace it anymore. Estradiol is the strongest of the estrogens, so it's the workhorse. Estriol is a weak estrogen, but it helps with bone density. So as far as options for taking testosterone or estrogen, and this goes for men and women for the most part. First, I'm going to start with lotion or cream. So it can be mixed into a cream. So with men, I typically write for testosterone with chrysin in a lotion. Chrysin blocks that enzyme to convert the testosterone to estrogen. Men need some estrogen, but not too much. And we keep an eye on that. We measure it and we make sure that they're not getting too much. So the chrysin is in there to prevent that conversion. So they get some, but not too much. It absorbs through the skin nicely. I have men that are on testosterone lotion. They love it. They're lotion kind of guys. And it works just fine. The downside is that it's a daily hassle. You put it on in the morning after you get out of the shower. So it's just like one more step in your daily routine. Most of us, our lives are so complicated, we're trying to simplify instead of adding on more steps. The other problem is transferring. So because it's on the skin, you can transfer hormone to other people. So that's why we want to do it in the morning, because intimate activities are typically going to be at nighttime instead of in the morning. And your skin is more open after it's just gotten out of the shower. And then you put clothes on. So it'll take an hour to 2 hours to truly soak into the skin. But if you hug anybody, you can transfer that hormone to somebody else. So your spouse, your children, your grandchildren, your coworkers, friends, your dog. So that's kind of a downside with the lotion. But it does work nicely, and I have clients that do just fine on it. Men, typically, I don't need to give estrogen to. I don't have a single gentleman that is requiring any estrogen support. Women, if we're doing a lotion, typically they need Biest, which is going to be the estradiol with the estriol. So we've taken out the estrone, so it's no longer Tri-Est. and it's biased with estradiol and estriol. The next way to take testosterone would be an injection into the muscle, which is called an intramuscular injection. Usually that's the thigh or the buttock. Depending upon the volume, you can do the deltoid if it's 1 cc or less. So that works well for men, but not women, because the volume is so small, it's just not practical. The volume's so small that it would end up still in the barrel of the syringe and in the needle, and not actually delivered to the human body. That's how women don't need much testosterone, so it's just impractical to deliver such a small amount in an injection. For men, typically you'll hear about men taking testosterone either once a week or once every 2 weeks. The best way to do it is once every 2 weeks, because then you get less estrogen being produced out of the testosterone. If men are still having a problem creating too much estradiol out of their testosterone injections, then we can write for a pill, which would be anastrozole, to block that conversion again. So that's easily managed. The next way to take testosterone or estrogen would be in pellets. Pellets are about the size of a Tic Tac, and they get delivered into the fat layer at the hip. So it's a quick office procedure. There's a small incision. Numb it up. The numbing is the worst part. It burns before it starts to numb. And then just place the Tic Tacs into the fat layer at the hip. So I only need to see about a hand's width of the hip. I don't need to see all the buttocks. I just need a hand width of skin. And I try and stay away from the belt line. There'll be some bruising that develops over the next day or two. That's normal. The nice thing about pellets is that it's just so convenient. You pop in here to the clinic once every 3 months, and then you're back out on the road. And you don't have to worry about it or think about it until the next 3 months. You don't have to worry about transferring hormone to somebody else. You just get on with your daily life. You don't want to get into the jacuzzi or sit in a bubble bath for the next day or two. You want to give the skin time to heal up. You don't want to go from here and go to the gym and do a bunch of squats or do a bicycle marathon. You don't want to work that gluteus hard and get that pellet to work itself back out and then pop out of the skin. But other than that, it's pretty straightforward and easy. Women, because of their fat layer, will convert the testosterone to the estrogen that they need. So I don't have many female clients that need a biased pellet, but it's available if a woman is not producing enough estrogen out of her testosterone pellet. For the men, I combine the anastrozole with the testosterone in the same pellet, so they don't have to worry about that estrogen production. And again, we do still monitor that. The pellet will completely dissolve on its own in 3 months, but it gives a nice, consistent, smooth, easy hormone level. So those are typically the best ways to take your testosterone and estrogen. Either a lotion, intramuscular injections for men, or pellet therapy. They all work great. I have clients on all 3 modalities. So I hope this helped. If you have questions, please post them, and have a great day. Thanks.